20 years ago, I was working with Win Parry and being around Win Parry at the Priory and you were, if you like, the other side of town, doing your thing. And it's funny how we've come from different angles and ended up more or less sharing a platform that says there is no one suit that fits everybody. I've heard you speak many times now where, okay, you've mentioned AA, you mentioned 12 steps, but you've mentioned smart recovery, you've mentioned CBT approaches, Christian, practically, and I know you've met with some of the Muslim guys who are doing great work in the Midlands, etc., with addicts. Just to bearing in mind to that backdrop that you've helped me open my eyes from traditional 28-day programs, right? One of the many people opened my eyes. What's your view now of rehab, and what's your view of the process of addiction treatment when someone's in rehab? Have you changed your ideas over the years, or?
Not really, no. I mean, I think there's a big issue now about what I've learned over the last few years is to try and get some kind of assessment of the level of involvement. How deep is the addiction, if you like? What's the gravity of the problem? Because obviously in this country we have a massive problem with binge drinking. People who every Friday and Saturday night will maybe go to bed with Marilyn Monroe and wake up with Marilyn Manson, or go to bed with George Clooney and wake up with George Formby and eat a kebab they would never dreamed of eating if it weren't for that 12 pints of strong lager. Yeah. But are they candidates for alcohol treatment? Maybe not. I'm talking about the people whose level of involvement is fundamental. The kind of people who Carl Gustav Jung described when he first met Roland Hazard somewhere around 1929. Where it's almost a spiritual malady. Spiritus contrast spiritum.
Yeah. The whole thing about what is addiction process and what is the treatment. It's interesting that the question about what makes you tick, what do you believe makes you tick, is never really asked at assessment.
No.
And yet when you look at the vast majority of treatment centres in the UK and and the Western world really, they once they've got the drug out of the body, they actually go for, well, what's making you tick? And the assessment of which is not. We're doing a follow-up study from Professor Cook. We're trying to establish people's prejudice against certain terms that are endemic within sort of 12-step treatment and even CBT treatment to some degree. Anything that involves self-help or mutual aid, and how people rile against naturally in this sort of secular society that we live in. They're against some of those words. And because they are, a lot of people are fundamentally put off the idea of going to either a self-help meeting, right off, I'm not going there, it's all about God, I'm not going there, or I'm not going to rehab because they do this, this and this. And I think as a professional, I think we really need to examine what we are assessing at the beginning and how we are introducing people to that, of the concept of change and what our concept of change actually is.
Well, I think the levels of involvement. So you can have I still think the big book of Alcoholics Anonymous, the book, is still one of the best books on addiction ever written, because it's very clear from that perspective. It describes what a problematic drinker is, a problem drinker or a heavy drinker, if you like, and it differentiates very clearly between a heavy drinker who can get in all manner of problems, whether they're an addict or not. Whether or not they're addicts of the type described in the big book of Alcoholics Anonymous and the basic text of Narcotics Anonymous, which is people for whom, I think this is the key, the people for whom drink and drugs were never the problem. Drink and drugs were the solution. They had the problem prior to the drink and drugs, and then drink and drugs were the solution to their problem, which is a fundamental existential dis-ease. They just never felt comfortable in their own skin until they found drink and drugs, and then the whole world made sense. The whole world went technical.